and then I'm going to share my screen. So guys, this is how I do my presentation. Pretty much word for word, it's the same exact thing almost every single time. Okay, so I'm going to share my screen and I'm going to start off exactly how I would start off with a client. Okay, so what I always do is I have slides that are made up. You guys can create these. They're super simple. We like to use Google Slides. They're easily shareable. They're easily customizable. This is exactly how I start every client meeting, and I'm going to do it word for word. Okay, so first, act like you guys are the client. First, I like to start off, right? We're doing business over the phone. We like to put faces to names. So this is my wife and I. Okay, so we run our business together. We don't work for a company or a corporation. We just work for ourselves. Okay, so if you choose to move forward on a plan with us, you will always work with us directly or our assistant. You will never be farmed out to anybody else or a 1-800 number that, for someone that doesn't even live in this country. You'll deal with us and our team directly. Okay. Now, we are based in Florida. So this is our Florida state license number. So if you wanted to jot that down, reference it towards the insurance database, that will come up for you. And again, we're licensed in 15 other states. So we're licensed all over the country. So we can operate pretty freely here. Okay. And then our business works very similarly to real estate. So like Keller Williams has a brokerage that hires agents who run their own business. Our business works the same exact way. Okay. Now our brokerage is called USA Benefits Group. They've been in business 37 years now, actually, and have an A+ rating with the Better Business Bureau. That was really important to me because I have a State Farm background. So obviously a massive reputable company that everybody's familiar with. When we went out on our own, I wanted to make sure we carried that same reputation with us. Okay. And again, we're brokers. So we've got about 400 different healthcare plans to choose from. Does that make me an expert in all of them? Absolutely not. It doesn't, but it does give us a lot of options to choose from. Okay. At this point, I'll say, does that make sense? Do you have any questions on that? That most of the time it's nope, that sounds great, fantastic. So the point of that section, one, you're putting a face to your name. So you're creating a little bit of trust, right? People want to see your face, but you're also coming in with the credibility right up front with USABG and who you are, okay? I go into our next session. So I'm going to bring up a couple different plans for you guys to take a look at today. One, honestly, I recommend over the other, but I never want you to feel pigeonholed into one plan. So I want you to know all the options you can take advantage of, okay? So the first one being an indemnity and specified disease plan. Are you familiar with those terms? Have you heard those terms? Most people are going to say no. I said, that's fine. I'm going to bring up the brochures and we can go over with them for you today. But just so you know, this is the same exact plan that my wife and I carry for our family, okay? So we use it all the time. We know it works really well. So now this one for you guys, whatever the number is, $440 a month for a couple. This one's $440 a month, and it includes 2 separate policies for you, okay? So really gone are the days where we can just sign you up for one insurance plan and it kind of does everything for you. Obamacare came in, kind of messed everything up. So what we do now is we'll take a plan where it falls short, pair it with another plan that'll pick up where the other one falls short, okay? So the most important thing with your health insurance, obviously, is your catastrophic. So, if we can get your day-to-day stuff covered, if we can get your doctor visits covered, fantastic. What I care about is the heart attack that you don't see coming and that we don't plan on, okay? That's what your specified disease plan is. So your specified disease plan, let me see if I can move this. Your specified disease plan, think of it as your catastrophic, okay? So this one's very simple. You walk into the hospital and you have anything on this list, Addison's disease, cancer, anything to do with your heart or cardiovascular, COVID-19, diabetes, gout, hyperthyroidism, major organ transplant, right? And you just go down the list. I don't repeat every single one. They can read. They're literate adults. I say you walk in for any of these, which are the most common things for an American to experience that's catastrophic. You pay $5,000 and then the insurance takes care of the rest up to $1 million. Okay. Does that make sense? At that point, most of the time, that's pretty simple. Yes, it makes sense. Maybe they have a couple of questions. Great. I'm glad I wanted to get that out of the way. That's the most important part to me to make sure you guys are covered in that event. Now, the indemnity portion, this is more of your day to day use. Okay. This is the one that you'll use more on a day to day basis. This one, the other one's called medical mutual. You kind of put that in your purse or your wallet for your worst case scenario. This one you carry more on a day to day scenario. Okay. And now for you guys, most people are going to fall into the classic plus or elite column. That's where most of our clients fall. Occasionally, you'll get someone with a big budget at elite plus, but most of them are going to fall into a classic plus. So we'll just go over that one today. So I'll say the numbers that you see here, the first thing I want to go over, all of these numbers, make sure this is very clear. This is not what you're responsible for that service. This is what the insurance company is going to pay for that particular service, okay? So the first example here, they're going to pay out directly $3,000 a day that you're in the hospital, okay? So let's use an example. God forbid you're diagnosed with cancer. On your specified disease plan, you walk in, you pay your $5,000 deductible, and then the insurance takes care of the rest. But you're going to be in the hospital for at least a couple of days. Let's say you're in there for only 2 days. This plan will pay out $6,000. Your deductible is $5,000. It's going to cover your deductible in that scenario in full. Does that make sense? Most times they're like, yeah, that's fantastic. That works great. Perfect. Awesome. We can move on from there, right? So every year it's going to climb up to $6,000 per day if it's due to an injury, which is typically the most common reason you're going to be in the hospital. Next thing I want to go over, emergency room and urgent care. Okay. Now you get one visit per year covered at $250. Is that a lot? No, it's not. And I understand that. But what I tell people, don't go to the emergency room unless it's an actual emergency, right? Because if it falls under your specified disease plan, you pay your deductible, we get our hospital admission benefit, we're in a good spot. Even if it doesn't fall under the specified disease plan, if you're admitted, you'll still get your hospital admission benefit. If you walk in because you stubbed your toe, honestly, no matter what insurance you have, there's not much that I'm going to be able to do for you. Okay. Even on your current plan, they go, yep, absolutely. That makes sense. The hospital is expensive. Now, if you can, go to the urgent care, because the urgent care costs about $150 to $200 depending on what area you're in. This plan covers it at $250. You're going to 9 times out of 10, that's going to cover it in full for you. Okay. And again, most of the people we're talking to are self-employed business owners. They're used to doing self-pay, honestly, most of the time. So they are familiar with how this works. And then I move on to surgery. So surgery is covered at 2 times the policy fee schedule. Now, honestly, that probably doesn't mean anything to you. It just means it'll cover 2 times what Medicare would cover for that service, okay? Medicare is for folks over 65. You're obviously a lot younger, a lot healthier, a lot easier to work on. If Medicare would cover $10,000 for a broken arm, this plan will cover up to $20,000 for that broken arm, okay? I use a couple of examples of our clients that you guys can use because you're a part of our team, whether you're in our downline or you're in somebody else's downline. We're all on the same team. Use these examples. We had a client a couple years ago. She got a biopsy done. It was about a $3,000 surgery. She only came out of pocket $100 for that surgery because there's no deductible to meet for that. Okay. We had another client a couple years ago. She went to one facility. They were going to charge her $87,000 for a broken collarbone. I was like, does her collarbone have cancer? We sent her to an outpatient facility 10 minutes down the road. They did it for $10,000 and the insurance covered it in full. Okay. So where you go matters. That's why, one, we're going over a lot of information today. It's going to be really difficult to retain all of this. 2, please reach out to us if you have anything major. Okay. Again, this is not a here's your insurance plan. Good luck. This is a here's your insurance plan. Please utilize us to the best of your ability because we can help you find the best place to go. Okay. Pause there. Any of you new agents, if you're worried about saying that, that's where your upline comes in. Okay. We've gone through all of that experience where I remember having a client reach out to me. They're like, hey, I need this surgery. And I'm like, okay, great. But then I just called Manny, right? That's where all of us comes in. So you guys can still utilize that. Okay. So back to the pitch. So again, please utilize us for anything that you guys need done because we can help you find the best place to do it. Okay. Again, you're instilling that, okay, these people are going to be here for me. They know what they're talking about. You're instilling that in them. Okay. And then I jump down to doctor visits. Again, I used to go over everything. Sometimes I'll jump back and forth. I like to just switch it up and keep it moving because it's just so it's not too monotonous. And again, they're retaining probably about 8% of what you're going to say anyway. So doctor visits. So now this, you do get 8 doctor visits a year. They're covered at $125 per visit. Keep in mind, this is in the First Health Network, so it's a PPO. There's no boundaries on where you can go, okay? As long as you're in the States, this plan is going to follow you. Now, the first question being, do you think each of you uses the doctor more than 8 times per year? Most people are like, no, absolutely not. I maybe have gone to the doctor once in the last 3 years. Okay, perfect. Awesome. This should work perfectly for you guys then. I just wanted you to make sure, if you use it more than 8 times per year, we've got a couple other plans maybe we need to look at that'll give you a few more doctor visits. Now, the nice thing about this plan is you can use it in 2 ways. One, you can use it like a normal insurance card, walk into the facility, hand your medical card in, let them take care of the billing. The second way is you can self-pay, send us a picture of the bill, we'll submit it for reimbursement for you, and you'll get a check back in the mail. A really easy way to do that is the chiropractor, okay? So most chiropractors, they don't work with insurance, and if they do, it's really, really complicated. So again, my wife and I have this plan. What we do is we walk into the doctor, we walk into the chiropractor office, we pay $40 per visit, we take that, submit it to the insurance company, and we get a check back as form of coverage, okay? And what I do, so I have actually an EOB here that I'll show them. So I'm sure there's some in the back office. Someone remind me at the end of this to drop it in the chat. You guys are more than welcome to use this. This is mine and Matilda's. So now this was on Philadelphia American, but it's the same exact thing anyway. So I tell them we just had a different plan at the time, but it works the same exact way. So we paid a total of $88 for the chiropractor. Our total benefits equal $240. So when we submitted that for reimbursement, we got a $240 check back, even though we only paid $88 in benefits. At this point, most people are like, what? You can do that? Now, and I also rebuttal that with, hey, now, is this going to happen all the time? No, I can't tell you you're going to make money all the time when you use your health insurance. But if you utilize it right in proper ways, it can happen sometimes. Chiropractors is an easy one for that to happen to, okay? Now, this is called excess benefit. As of right now, it's non-taxable income. So the IRS does not tax it. Now, it's our government. I'm sure at some point they will figure out how to tax this. But as of right now, it's not something you have to claim on your taxes, okay? At that point, they're like, great, this is fantastic. And this one, I'll show you guys this one. This one I don't really show to most people. Sometimes I will just for the fun of it. So this is, Matilda and I went to the chiropractor a bunch towards the end of 22, beginning of 2023. We paid a total of $435. Our total benefit was $720. We got a $720 check back, even though we only paid $430. I left that envelope on the counter for like 3 weeks. We all get letters from the insurance companies all the time. I kind of just toss it aside. I'll look at it later. I opened that 3 weeks later, and there was like a $700 check in there. So now that one I don't really show to the clients all the time. That one's a kind of exorbitant. That one might be a little too much to show them, to the point where they maybe don't believe it. But that's where you show them that smaller one, and you rebut that with saying, hey, is this going to happen all the time? No, it's not, but it can happen occasionally if you utilize it in the right way, okay? And then I move on to colonoscopies. So most people we're talking to, if they're in their 40s, they're getting about time to have a colonoscopy. If they're in their 30s or sooner, I don't really cover it because they're not getting close to it yet. But let's assume they're in their 40s. So when it's time to do a colonoscopy, you'll see that it's going to be covered at $500 for the colonoscopy itself. But you also have to get it done in a facility. So it's going to be additional $2,000 for the facility that you get the colonoscopy done in, okay? So you're gonna get $2,500 for a colonoscopy. We can typically find them for about $1,500 to $1,700 for a colonoscopy, okay? Now, blood work for surgical pathology, it's 200. For lab work, it's regular lab work, it's $50. What I tell them, always, always go to Quest Diagnostic, okay? Quest Diagnostic has a massive in-network discount with the First Health. We just had a client recently. They went, I think they were on Philly at one point. They got a $4,000 bill in the mail. That's because sometimes Quest doesn't submit it properly. They submitted it to their old insurance. We got it taken care of after the benefit, after the in-network discount. Out of $4,000, they paid till, what was it, $215, $225 out of pocket for $4,000 in blood work. So it's a crazy. Never ever ever have your clients self-pay for blood work. Always hand their insurance card in. It's a massive in-network discount. And I'll tell them that just like that. And then images is the next thing that I go over. So MRIs, PETs, CAT scans are covered at $500. Mammograms are covered at $250, and then X-rays are covered at $200. At this point, I'll ask them, have you ever paid for an image? And if they have, it's typically an exorbitant amount. They're like, yeah, I paid $1,500 for an MRI. I paid $2,500 for a CAT scan. I go, honestly, that's what I hear a lot. And it's honestly probably because you went to a hospital to get it done. Maybe you didn't know better. Maybe the doctor told you to go there. We have a website we like to use called radiologyassist.com. And again, I'm showing them all of this just like I'm showing you guys. We go here. Let's say you need an MRI done on your ankle without contrast. Typically, most MRIs are done without contrast. Our zip code is 33511. We're here in Brandon. Let's go here. So we can see here. Now, Tampa, there's a ton. Like, they're everywhere. If you're out in your rural areas, maybe they'll be a little bit further away. But this one is $290 for this MRI. My insurance covers it at $500. The MRI is completely covered for you, okay? Let's do mammograms, right? Women need to get their mammograms done typically once a year. Let's go mammogram. We'll do a screening, 3D bilateral, 33511. We'll come down here. This mammogram is going to be $125. Your insurance is going to cover it at $250. Okay. So again, this is where I come in. Now, at some point, you're going to be able to do all of this on your own. You won't necessarily need to reach out to me. But in the beginning, if you have any question at all, just shoot us an email, shoot us a text. We can help guide you, okay? The ambulance, I don't cover a ton. If we're throwing an accident policy on there, we'll cover it there. Allergy shots and immunizations don't really cover that a ton. Most people don't use that. I do like to cover the cancer benefit here, right? So remember, this is paying out $1,000 per day up to 40 days for treatment. Well, if you're getting chemotherapy and it's going to fall under your specified disease plan, so you hit your $5,000 deductible, if this pays out up to 40 days per year and you surpass that 5,000, that fifth day, you're in the green on this. Okay. So I'll say that's the first plan at $440 a month, whatever the price is, right? Make whatever the price is going to be for them. Do you have any questions on this one? Nope. Sounds great. Fantastic. Awesome. Yeah, we have a couple questions. How would this work? How would that work? You answer those questions. Once you're all done with that, you go, awesome, fantastic. That's the first plan that I would recommend for you guys. The second one is, this one's $550 a month for you guys, okay? Now, this one is a little bit more of a traditional style plan where it's got copays and deductibles. Some people really like this because of the predictability that comes with it, okay? So for this one, again, it's $550 a month for you guys. This one, again, more copays, more deductible structure. So you guys, let's say it's a couple, right? A couple in their early 30s. For you guys, it's going to be a $250 deductible per person. So you'll have a family deductible of $500, okay? So you'll have to come out of pocket $500. And then once you've done that, everything has a copay attached to it, okay? So you've got 10 doctor visits a year that you can use after you've hit your deductible. It's a $50 copay. Pretty good. This is the PHCS PPO network. So pretty widely accepted. You really aren't going to have a lot of trouble finding doctors. Okay. Your telemedicine, $0 copay. You get 12 per year for virtual primary, unlimited for urgent, 4 for mental health, and telemedicine pharmacy. You're not really going to use that. But that's a $0 copay for your virtual visits. Okay. Now, emergency room services, $250 copay. You get 2 per year. Pretty good. Your emergency medical transportation. This is actually fantastic on this plan. It's a $0 copay. So whether you're in a truck or a helicopter, the insurance is going to cover it for you. Okay. Outpatient services, you get 3 surgeries per year, covered at a $250 copay after your deductible. So worst case scenario, you haven't met your deductible yet. You haven't paid anything out of pocket. You're coming out of pocket $750 for a surgery, no matter how much it costs. That's a pretty good deal. And at this point, like how many surgeries have you had? I can't remember having any surgeries. Great. So 3 per year should be plenty for you. Now, if we're getting close to 3, maybe we need to think about switching plans. Maybe something's going wrong. Okay. Just so you guys know, life changes. If say we're having a bad year and we're running out of doctor visits, you can always make a change throughout the year. Okay. You guys are never locked in for 12 months. We can always make adjustments as needed. Okay. Now your inpatient services. So it's $1,000 copay. That's not per day. That's just $1,000 copay to get admitted. Okay. And you do have 3 hospitalization benefits per year, limit at a 10-day limit per hospitalization. So you technically have 30 if they're in separate incidences, right? So again, most times you're out of the hospital in 3 to 5 days. But there is a chance there that if you're in longer, that could possibly be out of pocket for you. Okay. Inpatient hospital surgery is also a $1,000 copay. The difference between outpatient and inpatient. Outpatient is, hey, I twisted my ankle. I've got some time. It's not life threatening. I can get it done in the next week or 2. Inpatient is my gallbladder burst. I need to get it done now or I'm going to die and I don't have a choice. That's the difference between inpatient and outpatient. Okay. Testing. So your diagnostic testing, x-rays, labs work, EKGs, ECGs, $50 copay. And then your images like CAT scans, PET scans, MRIs, $250 copay. Okay. So you guys are going to see a pattern here. Everything is $50, $250, $1,000, or $0 copay. Okay. Now, your preventative care screening and immunizations are a $0 copay. That's great for young families. One other thing that I like to go over here too. So pregnancy and maternity. So if this is a couple, like a young couple that has kids and they're planning on having kids, I like to go over this. Even if this is an older couple that's done having kids, but maybe their kids are going to start having kids or they know young couples, this is a good thing to throw in their brain. So, right, say it's an older couple. Now, if you guys know younger couples or your kids are starting to start families, this is a really good plan to take a look at because for vaginal delivery, it's a $250 copay. For a C-section, it's a $500 copay. That's the lowest I've seen. Usually you have to go to Marketplace and it's about a $3,000 copay. Okay. And then you just scroll down through here, right? There's other benefits for therapy, skilled nursing care, chemotherapy and radiation, allergy shots, right? Like you want to go over enough details where they know what they're looking at, but you don't want to go over every single 150 lines that are on, right? You're going to send it to them. They're looking at it with you. I do like to go over prescription drug coverage. So generic drugs are a $0 copay and preferred brand names are also a $0 copay. Now, if you're on a non-preferred brand name or a specialty drug, they do have what's called a patient assistance program. So if you get to a point where you're starting to take any of those, just let me know. Again, maybe we need to pivot to a different plan that'll cover it better. But we can also communicate with them, see if we can get you, a decent rate on it. Okay. So that's the second plan. Do you have any questions on this one? Nope. Sounds great. Thanks for showing us that. Yep. We have a couple questions. How does this work? Does this doctor take it? Whatever it may be. And at that point, typically they've already indicated to you that they're leaning a certain way. But if they haven't, I say, great. Last thing, do you guys have any other questions? Nope, everything sounds fantastic. Okay. For you guys and kind of your situation, which one are you guys leaning more towards? Oh, we're leaning more towards the $440 one. Okay, great. You guys have any further questions on that? Like, I want them to bring out questions. I want them to give them several opportunities for questions to feel like they've had the chance to express those. So they're like, nope, that one's the one that we really, are leaning towards. I say, great. With this one, there is an underwriting process. Now, you don't have to pee in a cup or do blood work or anything like that, but we do have to make sure we can get you approved. I don't know if we can get you approved yet. Based on what you told me, I don't think you'll have a problem, but we do just have to run it through the underwriting department. So what we can do is I can get the information I need. I'll ask you a couple questions, make sure we go through that. Go to the underwriting company, they'll pull an underwriting report just to make sure you're not hiding anything that we didn't discuss. And as soon as you pass that, we can get you effective. Again, you don't owe anything today to go through the underwriting process. Do you have a couple minutes to get that done? 9 times out of 10, they're like, yeah, sounds great. So you go through that, you get all the information. Now, you will need to take billing information today. So when I get to that point, maybe call it a sales tactic, maybe don't. I don't really care what you call it. I don't bring that up until I've gotten all their information. I'll say, hey, they will take billing information today, but again, they're not going to approve you until or they're not going to draft you until effective date. And again, at that point, you've been on the phone with them for an hour, not even an hour, but half an hour, 45 minutes plus. They've given you all their information. You've built that trust. They're like, okay, sounds great. And then you just get the billing information. Okay. So again, that's pretty quick as far as the presentation goes. When you're actually talking to someone who you're presenting it to, they're going to have questions. They're going to stop you. You're going to want to answer other things. But that's the premise of how my presentations go.